Hello, welcome back. My name is Travis and I am a faith-based cancer patient navigator. I would like to give you an example of our patient navigator services. These services are provided for cancer patients, their family, and their caregivers. So, there is a baseline of information that I ask in the very beginning before we do an intake. So we will set up an appointment for an intake either over the phone or in person. But when I first speak to either the patient, the caregiver, or the family member, I ask them a little summary of information until that date when we do the intake. So I will have something to work with until then. So as an outline, I would like to give you just a few questions that I like to begin with. Let's say a patient called in. I need to know what's the patient name, the address, the phone number, as well as the contact information and the email address. I need to know whether the patient lives with someone or if the patient lives alone. I also need to know the type of cancer that the patient has, the stage, and when they were diagnosed. I will need to know whether the patient is living at home or in a medical facility. Which medical facility that they are residing in, or if they're at home, what doctor do they follow up with, and the hospital that they follow up with would be great. I need the insurance information as well. I also need to know whether there is a cancer patient navigator within their doctor's office. Because if it is, then that means that we would only be a short-term cancer patient navigation service. They will follow up with a cancer patient navigator that's located in their medical facility. If not, then we'll give them as much care as we possibly can. Either way. Next, I would ask, what is the barriers to care for this patient? For example, let's say number one might be help with the copay. The patient might just need to stop the bill collectors from making phone calls to them. They cannot focus on their health care with bill collectors constantly calling them. Stress is not good for cancer. They might have some financial issues or financial situations, so they'll need financial assistance. That's number three. And they also need transportation back and forth to their treatments. The first would help with copay. I will ask them what type of cancer they have. I will keep that in mind. And for copay, there's a lot of different organizations that help you with copay. American Cancer Society may be able to give you that information as well. Cancer Care also provides some financial funding. Also, if you are interested in the Leukemia and Lymphoma Organization, also provide you with checks so that you can use towards your medical, towards your copay, or towards food, whatever that you might be in need of at that moment. It's a small something that might help out if you happen to have those particular cancers. Stop the bill collector from making phone calls. Okay, first of all, it's against the law for the bill collectors to constantly call you and harass you. Okay, we have to put a stop to that. Let's focus on legal aid. Legal aid assistance. If you're in New York City, I'm speaking about right now, legal aid assistance would help you out with that. Okay? Those are lawyers who are volunteer to help you and provide services for you. And there are some cancer lawyers that might help out as well. Any financial assistance, that's also Cancer Care, the American Cancer Society. is great with that too. And if you need transportation to and from your treatments, the American Cancer Society would be someone that I would look into. They have a volunteer program where volunteers will take you to treatment as well as pick you up, which helps out a whole lot, because without the treatment, you can't get there, you can't get the services that you need to help you get better. I hope this has been helpful for you. Please tune in again, and we will talk about another form of cancer patient navigation in your community. God bless you, your health, and those you love. I hope you will not have to go through this, but if you do, know that cancer patient navigation is here for you. God bless. I'll talk to you soon.